the World Health Organization has issued a call to action to eradicate tuberculosis by 2030. As part of these efforts, the WHO is launching an oral drug regimen it says can more effectively treat people with multi-drug resistant tuberculosis. The current treatment for MDR-TB involves a 2-year treatment course of injections, which experts say can provoke some bad side effects. The WHO says it is hopeful the new oral treatment program will be more effective in controlling the spread of the particularly virulent form of TB. In addition, the international health body made some recommendations that include cross-sector actions to monitor and review progress, prioritized planning and implementation of TB interventions, as well as a task force to ensure meaningful civil society engagement. Tuberculosis remains the world's deadliest infectious disease, killing nearly 4,500 people per day and infecting 10 million people a year. Joining me now on the phone from London is Dr. Lucica Ditiu. She is Executive Director of the Stop TB Partnership, with the mission to serve every person who is vulnerable to TB and ensure that high-quality diagnosis, treatment, and care is available to all who need it. Dr. Ditiu, welcome to Africa 54. Dr. Ditiu, can you hear me?
Yes.
Great, thank you. Thank you for joining us. Listen, is multi-drug resistance TB the biggest challenge right now in terms of containing tuberculosis globally?
Yes, and I will add to this the fact that MDR-TB is actually the biggest global health threat and global health security threat, because born disease. So as long as we breathe, we are all vulnerable, and every single person that is not treated can infect up to 15 others. So the more time we take to contain this disease, the more we will create other people infected. MDR-TB is a threat that we should all be aware, and we should all do what we can to end it.
So what is the strategy with the Stop TB partnership? WHO just talked about this one pill to treat MDR-TB, but what is your strategy?
So we are basically following, the same broad targets. WHO sets up the targets to end TB by 2030. What we do as Stop TB Partnership is we bring together all partners, private sector, civil society and communities, technical partners, donors, people affected by TB, researchers, under one umbrella, everyone to do their part to end TB by 2030. And African region is really having a huge challenge ahead. Weak health systems, but also due to the co-infection between TB and HIV, which is impacting obviously as well as HIV is now more of a chronic disease. What kills people with HIV now is not HIV, is as it was not before, is basically TB and MDR-TB. So as TB Partnership, we are promoting basically a strategic approach in changing the way we do business in TB, being more ambitious and making sure that every single partner comes together and pushes the same agenda forward for ending TB by 2030 and achieving some bold targets by 2022.
And Dr. Ditiu, before we wrap, then moving forward, what are the key aspects to focus on?
The most important piece are two. One is financing. The TB funding comes mainly from domestic resources, then from a global financing institution called the Global Fund for AIDS, TB and Malaria, and very little from bilaterals. And we are asking that hopefully additional funding will be available, especially for countries which are low income, and especially those that are from the region where we present in the African region. There is a huge need for additional investment in TB. Not only for scale-up of intervention, but also for research and development, as our tools that we fight currently for TB are very outdated. There is no vaccine. The treatment is, as you said, we have some hope with this all-oral one, but still takes a lot of time. It's a lot of pills still to be taken, and the diagnosis, we still have a point of care. Okay. So that's the situation. So I would say the most important piece is financing, and the other is coming together in a changed mindset to really fight this disease.
Okay, Dr. Ditiu, we have to leave it there. Thank you so much for joining us.
Thank you. Thank you very much.
And Lucica Ditiu is Executive Director of the Stop TB Partnership.